Hello. If you found your way here, I know your heart is heavy. Loving a dog is just one of the purest joys in life, and that's exactly why facing their final days is so heartbreaking. You're probably seeing the changes. Maybe the joy for walks has faded, or the nights have gotten a little restless. And now you're asking yourself that one question you're terrified to answer. How will I know when it's time? You are so scared of getting it wrong. I can't give you a simple, easy answer, but I can offer some clarity and hopefully some comfort. We'll walk through this together. I want to start by just sitting with this feeling for a moment because it is right at the center of this whole struggle. This quote, from a loving owner just like you, it captures that impossible conflict perfectly, doesn't it? For years, your entire job has been to protect them, to save them. And now you're faced with a choice that feels like the exact opposite of that. Please know, whatever you're feeling right now is completely normal. It's the sound of a heart that has loved so much. Our goal here isn't to find an easy answer, but to help you navigate this final chapter with that same deep love that has guided you all along. Okay, so let's talk about this because a really crucial first step is to recognize that our role as their caregiver starts to gently shift. For so long, our goal was all about curing. We gave the medicine, we did the therapies, we fought like heck to fix the problem. But as an illness progresses, or as old age just takes its natural course, our primary goal softly changes. We move from curing to comforting. Now, this is not about giving up, not at all. It's about shifting our focus from the length of their life to the quality of their life, and just making sure their remaining time is filled with as much peace, dignity, and love as we can possibly give them. Now, this is so important. I need you to hold on to this. You are the world's #1 expert on your dog. Nobody knows them better. You know the meaning of every little sigh, every look, every subtle shift in their energy. What we're looking for here isn't just one bad day. We all have those, right? We're looking for a pattern, a trend, where the difficult days start to outnumber the good ones. You have to trust what you're seeing. Your observations are the most valuable and loving tool you have right now. This is the question that so many of us come back to time and time again. It's a really simple but powerful way to kind of gauge their quality of life. A good day might be one where they eat a little something, they seek out some affection, and they seem comfortable and at peace. A bad day, well, that could be a day marked by pain or anxiety, confusion, or just a total lack of interest in the world around them. Sometimes it can help to just keep a little journal. A simple check mark for a good day, a little X for a bad one. Over a week or two, a pattern often starts to merge that can give you the clarity that you're looking for. So, what might these bad days actually look like? Well, here are some of the key signs that families tend to notice. First, a loss of joy in their favorite things. Maybe they don't greet you at the door anymore, or their favorite squeaky toy just sits there untouched. Second, signs of pain or discomfort. And this can be really subtle. It's not always about crying out. It could be restless pacing at night, hiding away, or panting when it isn't warm. Third, you might see trouble with basic needs, like a consistent loss of appetite or just not being willing to drink. And finally, significant struggles with mobility, where just getting up to go outside becomes a really painful, difficult task. Please hear me on this. You are not alone in this. Your veterinarian is your most important partner right now. I know that quality of life conversation can feel so scary, but I promise you, we are not there to judge you. We are your allies. We're on your team. We're here to listen to what you've been seeing, to offer a medical perspective on what your dog might be feeling, and to talk really openly about all of the options. We might use tools like a quality of life scale, but it's not a test you can pass or fail. It's just a guide to help organize your thoughts so we can make a plan together. And as we make that plan together, there are generally 2 paths forward. The first is what we call comfort care. You might also hear it called palliative or hospice care. This isn't about trying to cure the disease anymore. It's about aggressively managing the symptoms to give them relief. It means using the best pain medication we have, the softest blankets, their favorite foods, whatever it takes to maximize their comfort and happiness in the time they have left. And the second path, that's what we turn to when comfort just can't be maintained anymore. And it is truly the final gift. The word euthanasia, it literally comes from the Greek words for a good death. I know how heavy that word feels. I really do. But I want to help you see it differently. This is not giving up on them. This is the final, most profound act of love you can offer your best friend. It is choosing to take their suffering and place it onto yourself in the form of your own grief. When you can no longer give them a good day, providing a good, peaceful death is the kindest, most unselfish gift there is. And afterwards, the silence. It really is deafening. The house feels impossibly empty, doesn't it? All those little routines that have structured your days for years, they're just gone. The grief can feel like a physical weight in the room. And that is the price we pay for such a deep and unconditional love. The pain is real, and it is huge. And so, this is the most important thing I can tell you. You must give yourself permission to grieve. Your grief is not an overreaction. It is not silly. It is a direct and beautiful measure of the love that you shared. You haven't just lost a pet. You have lost a member of your family, a constant companion, a keeper of your secrets. So please be kind to yourself. Allow yourself to be absolutely heartbroken. And this, right here, is the heart of it all. This is the final, beautiful, and heartbreaking truth of it. Making this decision isn't an act of betrayal. It is the last act of love. It is choosing their peace over your own pain. It is looking your beloved friend in the eyes and saying, I love you enough to let you go. And as we close, it's so important to remember this information is for educational purposes and is not a substitute for professional veterinary advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.